Hi, everyone. I'm Samantha Jacobs, and today I am going to be interviewing a friend of mine, Dr. Sabrina Schell, and we're going to be talking about women who've had to deal with fertility issues related to cancer, post-cancer treatment. And Dr. Sabrina has been helping women with these types of situations, and I thought it would be a great topic for us to talk about today. What do you think about that journey for these women who are facing into cancer and potentially losing their fertility? Tell me a little bit about how all of this sort of unfolds for them, and what do you think would be the smart steps for them to look into and investigate and understand in their process?
Thank you so much for having me. It's so fun. I'm so glad we're doing this.
Me too.
Yeah, so maybe I'll give you a little bit of background of sort of like what I do and where my clients are at. I'm a licensed counselor, so I do psychotherapy. And my specialty has been sort of cancer and chronic illness, chronic pain, that area of sort of like holistic health, because I started out with medical and then moved into psychology. And I'm also a cancer survivor myself. So I do have a lot of, like a lot to pull from. And I love putting it all together for my clients, especially the cancer ones, because when they go through this, and they are sort of like done with the active treatment, that's usually when they come like seek out mental health, right? Because they feel like there's just like being dropped, right? Like it's very isolating in that moment, where, like you were like just fighting for your life and fighting, and everybody, like is rallying around you, like the doctors, your family, everything is just, like a wraparound thing. And then oftentimes when it's like, oh, you're in remission, then, like you become a statistic, doctors go this, and, like your family wants you to just be normal. And that's often when, like when a lot of other things sort of like pop up, like emotionally, and also changes in your body, and that's where, that's usually when they come to me. And one of these changes can be fertility issues.
Like, help educate me a little bit, because I would imagine a woman dealing with breast cancer or some kind of lymphoma, you're going through a treatment process that is quite destructive to your body. I mean, you want to live. This is about being able to live, and at the same point there must be, I imagine, a lot of fear, because you're going to lose your ability to potentially have children.
There's absolutely a lot of fear. Thankfully, we are at a point where a lot of the oncologists sort of do that preemptively, where they take care of your fertility, where they suggest egg freezing and those kind of things.
If they know the treatment process is going to change your egg quality, do they give you a period of time where you can collect and harvest your eggs?
Yeah, so that depends a little bit on the doctor and also on the specific situation. It usually depends on sort of like how advanced the cancer is and what kind of cancer it is, and like what stage it is, and what sort of like the protocol is to get you started. Because of course you don't want to get into the situation where, like an egg freezing cycle might take like 6 to 8 weeks, right, to like do it properly. And if your oncologist is already like, you need to start chemo yesterday, you don't really have the time for it. But oftentimes they are trying to like manage it in terms of the timeline so that it can be squeezed in before.
Okay.
And that is really the preferred way to do that.
How do your patients handle being diagnosed with cancer and then being told like you have to act now to survive, to be healthy, to live, and at the same point also you got to collect your eggs? Like, how do women move? How do you stay strong in all of that? I mean, that's a lot to handle.
It is a lot. Yeah, I agree. It's just so many issues at the same time. but what I've seen is like really like women being like really, really strong about it, right? Like you often don't even notice in the moment how strong you are, right? And they're just like just plowing through it, because that's just, that's expected. And I think it's almost like an instinct that kicks in, like of like, okay, survival, like, like
Okay.
it's very impressive to see. And I'm so in awe of like all of my patients, and just thinking back, I don't even know how I did it. Like it's just, you're just doing it. But that's kind of why I'm saying, like, oftentimes when it's all over and it's starting to calm down a little and they realize what just happened, is when they, like when they really seek like mental health treatment and sort of like more long-term approaches.
I can't, I mean, just trying to put myself in the shoes of you're moving through the process of going into remission from cancer, trying to protect as much of your fertility as possible. And when you come out the other side, how do a lot of women start moving through the next part of the process? Because you've collected eggs. How does all of that work for them to move on to having a baby? Do they need to wait a period of time after being in remission?
Yeah, no, I mean, ideally you would wait, depending also on the treatment, right? So, like you don't want to like get off chemo and immediately get pregnant. But it kind of really depends on like the case by case basis. And like I also had like clients who were like relatively young, right? Like they just did the egg freezing, and then like then they dealt with the cancer, and then slowly sort of like integrating back into their career and into their life, and they weren't really ready for having children.
Okay.
It really depends on sort of like where you are.
Mhm.
And also what kind of like sort of like long-term medication you're taking. So for breast cancer, for example, if you have the hormonal type, there's a lot of, you probably know that there's a lot of like hormones that you take then, right? Like the tamoxifen and all the fun stuff that our clients are getting. And that is also something like you don't want to get pregnant on tamoxifen, right? So I did have one client, for example, who was really like, she was ready to have a baby, right? Like she wanted to have a baby before she got like diagnosed with breast cancer. And then she immediately did the, like embryo freezing with her husband, went through the process. And like a year later, she was like, I want to try. And so they had to like stop the tamoxifen. So there's also always a chance of then taking a break from certain things, from certain medications or treatments, and sort of like almost like washing it out for a while, trying to get pregnant, and then after you're done, you can continue with the treatment.
I would imagine for some of these women, it must be very scary. Well, I'm assuming it must be scary to have a child because you've been facing into cancer and you want to be around. And like, how does all of that unfold for women? Like,
Yeah,
how do you put a priority on all of this so that things feel safe and you're going to have this baby, you're going to be around, and everything's going to be okay? How do women handle that?
yeah. There's definitely a lot of anxiety that comes with it, and that makes perfect sense. Like you said, it's so like it's you face this like life-threatening thing, and now you want to be around for like at least 20 years, right? To like make sure that your kid is okay. And there is a lot of anxiety for women. But we're usually able to like work with that in terms of just like taking perspective, right? Like oftentimes, like doctors can overwhelm patients with, like here are the statistics, and like you and I know, like statistics don't really apply to anyone ever.
Correct. And there's
So,
always the exception to every rule. It's like
yeah.
just when they think they can sort of Western medicine can put things in boxes, it doesn't work so well.
Absolutely. It's very much like, like when you're thinking about like an average versus like a median, like if you have like a high and a low of something, like the average is this, but no one's actually in that in that space, right? And so that's often happening with like a lot of statistics of like reoccurrences.
Do you know? No, sorry, go ahead. Interrupting.
So it's really a matter of like helping them take a sort of like bigger picture perspective and just seeing it as like holistically for themselves as possible, right? Like where are they at? Like let's not think about like statistics. Let's not think about like like what this person said or that celebrity posted or whatever, but of like how does my body feel?
Okay. So do you see most women are harvesting their eggs and then not fertilizing them? Do you see, like, does the industry, because of, in the IVF world, they want an embryo because that's the most stable, the genetic material becomes stable when it's frozen as an embryo. But obviously, if you're not with a partner and you're young, do they just freeze their eggs, or are they encouraged to fertilize them and make them into embryos?
So they have got so much better with like freezing eggs, right? So a lot of times people then just like freeze their eggs, right? Which is not a guarantee at all, right? Like no matter for what reason you're doing it, it's not a guarantee. And like the closest you can come to a guarantee is like a healthy tested embryo, right? Like that's almost a slam dunk. But like there are so many steps from like the egg to there, that can be a little scary if you're sort of just freezing eggs. But if you don't have a partner, I have not had any clients that were encouraged by their physicians to sort of like push for like donor sperm or something, just because it's gotten so much better with the freezing process.
Okay. Do you see young women who are single, like, I mean, you're not planning to have a family generally, right? You're young, you're living your life, and now all of a sudden you're facing into having cancer, and you're having to make all these big decisions around family planning. Do you see that conflict going on with those women? Do you see that they have a certain perspective or struggle within that?
Yeah, a little bit. I do see that with like a lot of like 20 or 30 somethings right now are like, I don't want, like I don't want a kid. And so I usually like tell them what my observation has been over the years in terms of like freezing versus not freezing, and then changing your mind, right? So like the women that like froze eggs and like later on changed their mind and were like, I'm totally cool without kids, right? They were like, okay, this is awkward. Now I have these eggs. What am I going to do? I can just, like, there's a little bit of like an ethical
dilemma
that you can talk about. But usually it's very easy for them to resolve, right? If they're already the type that doesn't want kids, that's, like that is much easier than if you're doing it the other way around, right? So whenever people are on the fence, I tell them, listen, if you do it the other way around, you don't freeze eggs, and then you change your mind later to want children, like that is an almost like that is a horrible pain, right? Like that's absolute torture. So if you never know if you change your mind, so this is the safer thing to do.
I mean, I would agree with you. It's always good to have a backup plan. And especially when it comes to fertility, I'm a big advocate for freezing. So I think, what the heck, we have the technology, and, just looking at young women who don't even have cancer, at least more insurance is willing to step in and pay for it. And, being able to focus on your career and your life, your well-being, if you've been going through cancer, I mean, it removes the burden of like, I got to have a family right now. It does allow you to have that backup plan. I would imagine that a lot of women don't understand either that could take quite a few cycles of IVF. And so if it does take a good number of cycles to collect some eggs and you are facing into moving into cancer treatment, how do women handle that? I mean, if you know one cycle is maybe not going to give you the best opportunity later down the line, do women get, well, I guess it's all based on their treatment if they have an option to do another cycle or not.
Yeah, I mean that kind of like gets us back to the, like whatever stage that the cancer is in, and like what your treatment protocol is. If you don't have the time to like do so many rounds, then you just don't have the time, and that's okay, and that's also something that you then like have to work on in terms of like processing that psychologically, that you just didn't have the time, and that's
Okay. It must be really hard emotionally to know that your fertility is going to be taken away from you. How do you work? How do you help patients move through that to see? I mean, I can't imagine, breast cancer, losing your breasts, losing your ovaries, and ovarian cancer. Many, many moons ago, I had a patient who was 34 who came to me. But she was coming to me to get treatment as she was going through her chemotherapy. And breasts removed, ovaries gone. And, going into menopause. I mean, I can't imagine what it must be like to be young, fertile, and then to have all of that removed. Like, that must be quite a shock, well, physically and emotionally.
Yeah, absolutely. Yeah, like you said, the first thing is like, like it gets you into menopause, which, like no 30-something-year-old wants like perimenopause symptoms, because that's not fun. But also the emotional component, there's quite a lot of grief. Like thankfully we have techniques of like, like egg freezing or other things that we can do prior or post treatment that can get you to have a family. But for some people it doesn't happen, and there's a lot of grief that has to be processed.
What do you do with your patients to help them move through that grief of not even per se, maybe not like, obviously it could be a very tremendous grief never to be able to have a baby, but just in this more of the moment of going through treatment, coming out of treatment, that you've lost a part of your fertility. Like, how do you help patients with that? It seems like huge.
I mean, it's traumatic, right? Like it's such a big part, and especially for like the kind of women that like really feel like they want to be a mother, right? Like you probably have that in a lot of your clients that are really like, like I just need that, like I cannot breathe without it, and that's really hard to let go of, and the only chance you really have is to transform it into something else. Letting go is just like so hard. But sort of like peeling that back in terms of like, what is it about that, right? Like what is that purpose that you're feeling behind it? Like what is that nurturing aspect? Like where's that, like what were you looking forward to? What are sort of like the things that like you can then take and turn into something else, right? So, like that you can turn into caretaking of some other sort, or, like teaching or leaving something behind in another way. Being more engaged with other like children in your life, right? Like there are a lot of like kids out there that are very lucky to have like the most amazing aunts because they couldn't have it, right? And that's one of the like great gifts you have. And so I think it's a transformation of
I think as I get older, one of the things I'm realizing, this whole idea that you just let go of something. I mean, if it's something minor in life, that's one thing, but when they're very pivot points for us, that they do become a part of us, and then it becomes a choice. Do I allow this scenario to create something that doesn't make my life productive and full, or do I move in a different direction and figure out how to rearrange my life, which is by no means a small feat. It's easy to say, comes out of my lips very easily, and it's huge. It's very profound. But at the same point, that transformation leads to a new direction and a new outcome, potentially a new different outcome. So I think that's so well said. I love that idea. I think there's so much grief in infertility, and we don't talk a lot about it. Never mind the cancer part, but just the idea that you're not going to be able to conceive as easily as all your friends. There's a grief of that. And then if things become more complicated and layered, there's grief around the steps, the extra steps that have to be taken and the extra decisions, everything. Grief about it was supposed to be really easy. And now this is becoming work. And then to add in the cancer portion, I would imagine you must be seeing with your patients that grief is constantly kind of popping up for them.
Absolutely. And grief in itself, even without the fertility aspect, right? Like grief and guilt are like so prevalent as emotions, right? Like later on, like when you get through it, then that is one of the typical things I work with people with.
Do you find then that women are dealing with so many levels of grief going through this process that they're overwhelmed trying to handle all of that?
I think that's exactly where the sort of like numbness comes from while you're going through treatment, right? Like it's just so overwhelming that, you know, like if you let that in, like you're gonna break down, and you can't afford to break down because that literally means you die. So I think that is where that's coming from, that, you know, like a lot of women like really like power through treatment, and, you know, like it's just like full steam ahead, and they're just like not letting that grief or that fear like touch them in that moment, right? And that's a protective mechanism. But again, there's a reason why, you know, like later on, you know, like I see a lot of them sort of like coming in like a few months after, where, you know, like it just all falls off, and that armor falls off, and then is like that grief just hits you.
Okay, comes in layers. Do you find when you're talking to your patients that, you know, you got everybody rallying around you to move, you know, to go through treatment, to face into cancer, and then when you've moved through that process and you can't get pregnant, do you find people are sort of not sympathetic? I mean, I have one patient, thinking about this woman from a long time ago, and she was like, you know, someone told me, you know, you should be happy you're alive. You know, why are you so upset that, you know, you've lost your breasts and your your ovaries, you're alive? And she's like, she doesn't, you know, I remember her saying to me, my family member doesn't understand how much other things I've lost. So do you find people can kind of be dismissive once they've moved through the process of cancer?
Yeah, I think that's one of the like very common things, that like why you're feeling so isolated with it, right? Because it's so hard for people to understand if you haven't been in the situation, you know, like you don't know, and it is a very isolating experience, right? So like when I you know, like when I teach this to, you know, like other counselors, I usually sort of like have that model of, you know, like trauma can be sort of you know, like either interpersonal or just natural, and it can be, you know, like it can be like a broader thing, like a group thing, or it can be individual, right? And so when you think about, for example, like, you know, like war veterans, right? Like that is an interpersonal trauma because there is an enemy at the other side that does that, right? And it's a group experience, right? Just like a um, like a fire or some sort of natural catastrophe, right? Like that's random. No one's doing that to you. It's just happening, but it's also a group experience, right? Versus this, this is so it's, like everything is fine around you. Everybody's fine. Everybody's loving on you. Everybody's trying to help you, trying to support you. The world around you is like chill and perfect. It's just that inside of you, there's still the danger of death, right? Like no matter what the world outside does, and that isolation, that like feeling trapped in your own body in that way with that kind of like significant trauma is what really like creates that rift then sometimes between the patient and like their family and friends, because they just don't, like they just don't understand it.
I find, like, you're talking about trauma. I have often wondered, I think sometimes looking just at fertility treatment, I'm going to put loose terms that it can be traumatic.
Mhm.
It's so complicated and there's so many steps and it's like this roller coaster ride. So I see some of my patients having repercussions. Do you find that women going through cancer and fertility issues have like this, it's like, it is like a trauma. It leaves a wound that impacts the way you see the rest of your life and your well-being.
Yeah, absolutely.
We
It
don't,
really
we don't really talk about that, do we?
Yeah, I don't. I mean, like, who would, right? Like, I mean, I think like oncologists don't, or even like fertility doctors, like, like they come in, they do the treatment, and like they have a lot of patients, and like it's a whole clinic setting. And unless patients voluntarily come to, like people like you or people like me, they don't get offered that space to talk about it. Right? I think there would be more conversation because that is clearly on most patients' mind, but they're not getting, they're not getting the environment oftentimes where that's allowed.
So I'm curious, you're going to educate me. I think I'm the kind of gal who loves deep conversations, so I can go into the depths of conversations, and I'm okay with it. And I think passing away, when my mom passed away, I had so many reactions of people not being able to sit with it.
Mm.
The idea of losing, I imagine as a woman dealing with cancer and fertility issues, like you're losing a lot of things. And I can imagine there's probably a lot of people who are very uncomfortable being able to be present with them and just,
Yeah.
you don't even have to really say anything, but just being present. So do you see, your patients struggling with communicating and feeling like there's like a deeper connection between key people in their family? Because I mean, it must be scary for their family to think that they could potentially lose their family member. Do you see
Yeah.
that kind of conflict going on?
Yeah, and it's interesting because that conflict is like a little bit like the timing is very interesting of it, right? So like usually when like I said, it's almost like two phases, right? Like going through the battle and you're like all in it, and versus like afterwards, like breaking down. Usually family members, like the reason why it is so hard for them to like to relate or to like sit with the experience is because they're often having like the reverse experience, right? Like for them, it's like they're falling apart because they're, like they're seeing their family member, their loved one going through treatment, and that is hard, right? Like especially if you think about, like younger like younger women go through this, like their husbands, their mothers, like this is like the hardest thing ever. And then when they're sort of like in remission, and then they're breaking down, and usually the family is like, but you're in remission, yay, it's all good, like, and they have no, they have a hard time to then sort of like continue their, like continue their empathy because, like they're all they're all out of energy. They just did that for the whole time, right?
How strong a woman has to be to not only step in and have her life potentially threatened, but also then to take on the aspect of trying to preserve her ability to have a child later on in life. It's one heck of a lot of things to tackle. And
I just had a thought about that, sort of like that layering. It's also in terms of just like the physical things that you're doing, right? So when you go through cancer treatment, like depending on like what kind of treatment you're getting, and it's now like it's getting a little better because they're getting more pinpointed with their treatments, which is absolutely awesome. Versus like 20 years ago, it was just, like all the chemicals and you're never leaving the hospital, and maybe like like maybe the cancer dies before you and then you're good. And now they're a lot more advanced. However, there's so many like injections and so much probing and so much of the sort of like the physical pain, right? So there's the emotional trauma and there's the physical trauma. And then when you take that and you're finally done with it, and then you go into IVF, even though, like if you have like great chances and a great team and this is to like make a baby, it's still more injections and more probing and more needles and more, like anesthesia and more, like all these things that you've had enough of for like 3 lifetimes.
Many of my fertility patients find that they have to learn a new language, and that is the language of fertility, to be able to understand treatment and options and the direction they want to take. And here we have women dealing with cancer, and you have to learn the language of cancer. So in a very small period of time, I kind of consider it's like literally learning a foreign language.
Yeah.
And you have to become sort of an expert very quickly.
Yeah.
To be able to advocate for yourself, ask for what potentially an outcome could be, and how do you optimize that? Do you find that when you're working with your patients that you're helping them learn that language?
Yeah, absolutely. That's for sure, like that's for sure something that, like we talk about, and we talk about options in sort of like a more drawn out way than what they would get at like a fertility clinic, where it's like, this is our protocol, tick, 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 right? Yeah, I think it has a lot to do with like self-advocacy, which I really like to push anyways for like cancer survivors, right? Like you have to advocate for your body, you have to understand what's going on, and like you have to you have to do the same thing in fertility treatment, right? So like that really transfers over, that like encouragement to participate in like a lot of like self-advocacy.
I think the emotions are such a big portion of this.
Mm-hmm.
And how stressful. I mean, the stress is out of this world, and stress doesn't help with your fertility. Doesn't even help with your whole well-being.
Right. Yeah. And I think it's really important to also point out sort of like the interconnectedness of like your immune system and your hormone system, right? Like, and your mental health system, because they all share the same like neurotransmitters, right? And the same hormones as like as they talk to each other. So when one, like it's almost like dominoes, when one falls, like the other two usually go too.
How do you help women de-stress? Because I think you would probably agree, I think most people, meditating is just not their gig.
Yeah, so one of the things is when they say that, I usually ask like, why do you think meditation is not like your thing, right? And oftentimes I hear like a variant of, oh, I can't shut my brain off. My brain just doesn't do that. I am too active. Like I'm too anxious, and like I can't just sit still for half an hour and like not think. Like, and I'm like, that's not meditation. That is being dead, right? Like if your prefrontal cortex is not talking, something's very wrong. So I think one of the big things is always, like I'm trying to like educate people on like, like how to do like mindfulness and meditation and those kind of things in a way that like works for their bodies, right? So it does not have to be like shut your brain off for like half an hour and sit still. No one can do that.
To just go outside and take a walk down the street, listen to the birds, look at clouds. I tell my patients it doesn't have to be fancy. It just, it can just be simple movement and just taking in your environment. That's how I approach it. How do you approach it?
Yeah, I mean, anything that sort of like grounds you in the moment, right? Like is a mindfulness thing. If you can't or you don't want to outright meditate, you can. There's so many mindfulness exercises that you can do, right? I think it's more about sort of like your awareness for the moment and for your body and where you're at, right? Like just like considering your space internally and externally and just like noticing. And whenever like a judgment about it comes up, right, like dismissing that judgment. Like that's the one thing about meditation. It's not about like shutting up. It's about, like not judging what you're thinking. Like clouds that just like go by, like like your mind is still there. It's the blue sky.
Yeah.
But I love the nature thing. I'm such an advocate, and you know that like one of my modalities that I sort of like do as a little side thing and have been for like decades is equine assisted therapy, right? Like I just love it. Like horses, animals in general, like wonderful for grounding, right? Like people who like who are not very like good on like their good on foot, especially like when you just went through like something like cancer treatment, right? Like you probably don't need to like get on a horse. But I'm also like such a big animal rights advocate, and I always like consider it sort of like a like it has to be a mutually beneficial thing for both of them, right? And just like meeting on the ground, sort of like untethered in nature, and just like building a connection that like is like nurturing for both of them. That is one of the most beautiful things you can do.
When I was traveling around and treating patients, one of my patients trains dressage horses, and she had this beautiful Sophie. And my patient said to me, "Want to go over and see Sophie?" I was like, "Oh, sure, let's go see Sophie." And I swear to God, I've never had this experience with any animal in my whole life. Sophie, very gentle, and I was standing and I was just like petting the top of her forehead, and she looked at me. I swear to God, I could feel this energy coming off of her, wrapping around me. And in that moment, that week, I had a really rough week. My mom was ill, and it wasn't the best of times. And it was almost as though this horse knew I just needed to feel loved. And it has left an impression on me ever since then, to see what this horse knew I needed something, and how freely it gave to me. Do you find that you're also having to educate women about all the drugs, the process from IVF all the way to the cancer treatment? Do you find that you're kind of the touchstone for them to be able to understand what they're going through?
Yeah, sometimes I think it depends a lot on sort of like who the rest of their treatment team is. Like sometimes you have people that are just like very well informed, right? Like they, like they will really explain why they're taking what. And sometimes sadly you don't have that, right? Like, and then, like they start Googling things, and like with all the algorithms nowadays, then they got like all these like negative reinforcers, which is a very, very bad no for, like for your mental health. And so I usually say, like if you have a question and you don't have access to like your physician that prescribed it, like please don't Google it. Please just come to me in our next session, right? And we will talk about it. That's just, I think it makes more sense to hear this from like another person that has sort of like a broader overview of it and like training versus, Google.
I find, most of my patients are on Reddit. It's a double-edged sword. Sometimes it's got good information, I'd say most of the time, it's a lot of gobbledygook, and it just complicates things and makes it harder to make good decisions for yourself, that you end up swirling in your own thoughts as it gets triggered by all the information that you're exposed to.
It can really like heighten your anxiety around things, right? And there's already like so much illness anxiety, right? Like this like anxiety of like reoccurrence and like what if something goes wrong. And that is very natural because your brain just experienced that something went very wrong, right? And so it's natural that this is now an option for your brain, right? Like this is now like, well, it happened before. So you don't want to have that like reinforced constantly, because the one thing that makes anxiety worse is this like reinforcement internally, right? Like spending energy on it. And it's exactly the same thing that happens with the algorithms, right? On Reddit or on Google or you know, on social media in general. Like the more energy you put into something, the more you get out of it. So if you do that on your computer and in your brain, then, you know, like it's just like ding, 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 and just like getting more and more.
Okay, hang on one second, Sabrina. I wanted to ask you a really good question and I just went blank on it. Oh, damn it. Sam, think about that. What were you thinking? Thanks, menopause. Oh,
that's another fun one, you know, like brain fog.
Oh dear God, the brain fog is terrible.
Yeah.
Someday it's gotten better as I've been like I'm like 3 years into menopause. It's like getting so much better, but there's a long I can remember what I used to be able to be in my 40s.
Sadly, it doubles up, right? Because you get brain fog as a result from chemotherapy, and you get brain fog as a result from perimenopause, right? So if you have women that go like chemo for, you know, like breast cancer or something, and then go into like perimenopause because of the like, it's just like they can't think. There's like nothing left. And there's so much patience required, right? Like so much self-care and so much, you know, like understanding that this is transitional. It'll come back. Have patience with yourself. Be nice to yourself, right? Like the more you relax, the more, the better it gets.
Well, I would imagine taking a stab that there's probably a certain amount of grief also seeing who you used to be pass away. I experienced that going through menopause because I could remember who I was with a full brain of estrogen. And now here I am in estrogen deprivation. And there's a sadness of like, there's a part of me that's never going to exist again. And she functioned really well. She had everything together and she could juggle 1,000 balls in the air. Now I can juggle about 10 balls. And thank God for the phone, and I can set myself some reminders. Society doesn't has a hard time putting compassion, that's not the right word. Here we go. Compassion for women who are healthy. They look healthy, but there's stuff going on. We don't really provide a support for them. Doesn't matter if it was cancer or fertility. It's like I repetitively see it, like fibromyalgia, you know, chronic fatigue. We don't have a support mechanism. You're young, you're healthy. You know, you just need to think more positive.
Yeah.
You're just manifesting your health, right? And it's like,
yeah, totally. And then with that, exactly, you sort of like, you know, like there's a lot of masking going on, right? Like there's a lot of like masking your, you know, like your sadness, or, you know, like thinking that there's something wrong, that you're sad about this, right? Like I really hate when people then like start taking antidepressants, because it's like, you're supposed to be sad. This sucks, right? Like your body is doing the right thing. It's sending the right signal, right? Like let's work on that. Let's, you know, like breathe through that. Like you're still here, and let's work with that, rather than, you know, like this but there's so many great ways to do that, right? Like all like with the cosmetics nowadays, or like, you know, like a lot of times from chemo you don't lose your hair anymore, or if you lose your breast, there's all this like reconstruction, which by the way is a much harder surgery than going flat, right? But like we are so good at, you know, like, no, I'm a woman, I gotta be pretty, because otherwise like you get all this like weird feedback from society, right? They're not there to hold you. And so that's right, it's a, you know, like other people don't want to see you like this. So you have to like really, you have to really sort of like do some soul searching of like, what is it that you want, right? Like for like a lot of women it is, you know, like that they want the reconstruction because that's just how they, you know, like how they know themselves, and that's, but there's certainly also like, you know, like a lot of pressure around a lot of sort of like beauty standards, right? And standards of like what it means to be a woman. And, you know, like with something like breast cancer or infertility, like there's so much internalized shame also, right? Like when you're like not that stereotypical, like, you know, woman that is supposed to look like this and do that and act like this. And
well, I mean, we're talking about the layers here, because if you're like my previous patient, 34, and your ovaries are removed, you're going into menopause and loss of collagen and muscle firmness, hair loss. I mean, it's real.
Yeah.
And to have that pressure at that age, that you're not going to have that same beauty standard. I mean,
yeah, there's so many layers about this, honestly, and so much.
Totally. I am blown away by this conversation, which I'm really glad to have had. I'm always looking for something to open my eyes in the fertility world. And that's one of the reasons I'm trying to do these interviews, because I think it's limiting as women that we tell other women, this is how your journey has to look. The journey is so diversified, and the more we can think out of the box, the better options we're going to give other women to help them preserve their fertility, be able to conceive, rather than keeping it's got to be like this little tight box.
And I think that's so important, because, you know, like every person is so different, and, you know, like the more tools we have to offer, the better, because not everybody wants to do it this way or feel that way, you know, like, and there's a lot of differences in how people, you know, like in how people want to move through life and see themselves post cancer, right? Like some are like, you know, like running around with like pink ribbons all day, and some are like, I just want to forget about it. And the same for the fertility world, right? Like it's, you know, like there's a lot of like, it's very individual, and that's definitely something I work on with clients a lot, is this sort of like, how do you feel about what you want for yourself and what you want for your family?
So I will attach your information, because if anyone wants to reach out to you, that will give them the ability to do so. And I appreciate you coming and spending this time with me. Thank you so much, Sabrina.
Oh, thank you for having me. Much fun.